Emphasize that quality will remain the most important factor. Tell the patient that the entire staff works with them knowing every single minute that the most important step in quality care is the one being done right now, that you always do your best. And then put the same responsibility on their shoulders with the expectation that they will take care of what you and the doctor lovingly placed and what they responsibly paid for. The question, how much will it cost? What patients usually mean when they say this is, how am I going to pay? So be ready to share several flexible payment options, but emphasize that the financial coordinator will discuss it with them, and always make sure they know what the full fee is before being asked to arrange payments. While discussing fee payment is probably the least enjoyable element of dentistry for the patient and the staff, it's easiest when the patient understands the value of the treatments and is motivated. So instead of concentrating on how to manage collecting money, spend more time developing treatment plan presentation skills. Anytime a patient expresses uncertainty about the fee, they're sharing their reservations about the value of the proposed care. Minimize the role that cost plays, and your patients will find the money for this treatment. They truly want it. Build value into dental care. Dentistry is one of those fields totally alien to patients. When you buy a new home, you don't care that the land costs this much, the brickwork this much, the cabinets this much, and so on. So don't nickel and dime patients either about dentistry. If the proposed procedure is a root canal, post and core, and a porcelain crown for a front tooth, share one fee with them that includes it all, and make sure they know that it includes it all. Avoid surprises. By emphasizing that a particular fee includes the entire procedure, radiology, anesthesia, surgery, follow-up care, you can contrast it with practically any medical procedure and underscore the value implicit in modern dental care. Even before they ask, it's nice to think ahead and share what a given procedure will be like. Many patients may be too fearful to ask, either out of embarrassment or maybe even out of the fear of hearing what you're going to say. Stress modern dentistry's comfort, the use of stereo headphones, television during treatment, needleless anesthesia. Flaunt everything. And if something will be uncomfortable, be honest about it, but don't overdo it. Simply reassuring them that the doctor does everything he can to minimize discomfort is usually enough to calm their fears. Now, more difficult than remembering what to say is remembering to listen. Let patients do 70% of the talking early on. Active listening means never, ever interrupting patients. Interrupting patients dramatically reduces their acceptance of treatment. Plus, what they share must be heard to help properly build your doctor's treatment plan. As patients warm up to your practice and you learn more about them, certain yes-no questions can further identify treatment desires. The simple question, would you like whiter teeth? It can sound like a hard sell early on in the relationship, but when asked later on, they appreciate your interest in wanting to help them. Concentrate on questions that build excitement. Would you be interested in replacing your missing teeth with the kind that don't have to be removed? And finally, tell them how the proposed treatments are going to look, and even better, show them. Use before and after photos of consenting patients. Use wax-ups. Use computer-generated morphings. There's no end to what you can offer. Even a sketch on a piece of paper is a big help. And if you've got something that they can take home with them, all the better. Quality dental care is not cheap, but proper preventive home care is. Patients must be motivated toward wanting and toward maintaining their dental treatments. Otherwise, you're not offering them a service at all. The leading objection to accepting dental care is usually cost. Even with dental insurance, state-of-the-art dental treatment still involves a significant investment by the patient. Now, there's some good in this, since the degree to which patients care for the new dentistry seems to directly correlate with how much they had to personally invest in it themselves. Most people buy new cars using a monthly payment plan, opting for several $100s a month instead of several tens of thousands of dollars at one time. and essentially everyone does the same for their home. In both cases, on the average, the car or the home is enjoyed for just a few years before they move on to something else. Well, comprehensive dental care is different. It's a lifelong investment, a lifelong enjoyment. You can tell you're beginning to help them receive the care they need when they ask questions like, what kind of payment plans do you have? Or can we do the cosmetics first? Or how long will it take to get through phase 1? These are buying signs, not commitments. They simply mean that you're gaining the patient's trust. If you get questions or objections first, and usually you will, remember they aren't attacks. They're normal, natural steps in a decision-making process. They aren't saying no. They're asking for more information. It's their not offering objections in the first place that shows that you aren't getting through to them. So when they say, "Ooh, it's awfully expensive," or they might say, "My friend says it's painful," they're sharing concerns and they're inviting responses to them. You'll only be able to help if you listen deeply when they share these concerns. When a patient trusts you, you'll get their acceptance. Acceptance of treatments, fees, time involved, but most important, acceptance of you. When everyone in the office has done everything they can to maximize exceptional care, the patient joins your team. Now they'll share their growing trust through positive statements like these. "I guess I'm worth the money." You must immediately respond with a support statement of some sort, like, "Yes, you'll keep your teeth for a lifetime." It's reassurance that they've made the right decision. Imagine how a patient feels if he hears, "You'll look younger," or "You'll be able to chew better than ever," or "Your pain will be gone." After offering this support statement or support response, to determine if a patient truly wants what you can offer, you might hear the doctor ask them something like this: "Miss Smith, if money were no object, would you want to have this done?" If the response is yes, all that remains is to share the fee and arrange payment from the available options. Some other excellent responses include, "How do you feel about all of this? Do you have any more questions? And do you think that this would be good for you?" Never apologize for what dental care costs. Compared to almost anything else, it's a bargain, especially when you consider how long its benefits are enjoyed. Reinforce the fact that the results are well worth the investment. Besides, you didn't get them in this condition of need, but you can provide the solution. Keep in mind throughout that the real issue is most often how is the patient going to pay for the treatment, not how much it costs. As a prelude to the final commitment, a good indirect question might be, "Miss Smith, would you like to start this treatment in the next 2 weeks?" Any objection at all means the patient still has unanswered questions. A follow-up consultation at another appointment might be in order. There's nothing wrong with taking several visits to get a yes from the patient. What is wrong is the high-pressure hard sell that comes from pressing for a decision at that first appointment, that day. Use patience. Develop a relationship first, and it may take some time and several visits. Some doctors trust staff members' participation in formally presenting these treatment plans to the patients, and if you're among these, you really should be proud. Your doctor is expressing the highest possible level of trust and appreciation. Keep these pointers in mind. The treatment plan presentation should begin by talking about one of the patient's interests, their pets, their new job, or some other aspect of life totally unrelated to dentistry. They'll become more comfortable, and you'll be recognizing their individuality. The patient will be presented with your neatly typed presentation form, enclosed within an attractive folder personalized to the practice. Reassure him that the doctor has prepared this case completely and invite him to ask any question at all, promising a detailed answer. And throughout the presentation, silently remind yourself to speak with and not to the patient. Say "we" whenever you can to foster a team approach. For example, We feel that saving the teeth will actually save you a lot of later discomfort and expense. Plus, there's power and safety in numbers. The patient hears that many minds have worked on these treatment ideas. Also, concentrate on the future benefits, not past failures. Be in agreement. Be in agreement on how attractive the patient will look, on how comfortable she will feel, on when the case will be completed, not if. If you focus on the if, the patient concentrates on yes, no, instead of listening to the benefits. And also, stay away from technical jargon like half a millimeter of porcelain and other impressive statistics. Present the prospect of whiter, straighter teeth. For the most part, patients don't have the ability to judge technical results, so why emphasize it? What they can determine are the benefits that they'll enjoy. While you never want to make promises you can't keep, dentistry is predictable enough that you can make certain promises in absolute confidence. A better quality of life, improved oral health, a more comfortable existence, a prettier smile. There's no need to fear when you make these promises. When everyone's doing their best, there's no doubt that they'll come true. Promising benefits is not dangerous if you can deliver. Every treatment presentation should include some time to focus on the patient's future. You might share something like this. Mrs. Smith, deciding to have treatment is a wise decision both for the present and the future. You see, by doing it now, you're going to prevent the need for more major treatment or even the prospect of losing your teeth when you're older. So what we do now will avoid a great deal of dental treatment and discomfort in the future, and you'll be more confident, and you'll probably receive a lot of compliments on your smile. Patients have high expectations. It's why they're consenting to the treatments in the first place. You won't be sharing anything with them they aren't hoping to hear. Promises demonstrate confidence.